People may ask for death when they're suffering. That can happen. As a psychiatrist, I see that a lot also from mental illness. That doesn't mean that that's what somebody actually wants necessarily at that time. What it typically flags is that they are in a state of suffering. If our response to that is, as you're saying, eliminate the sufferer, I think as a society, we need to question what are we doing. But what's quite surprising is that a lot of people are acknowledging this and still thinking the expanded MAID pathway makes sense. I can tell you that Mr. Meunier in Quebec, so some people might be familiar with that case, but this is the case of this very sad case of this gentleman who was quadriplegic. He didn't want to die. He was being taken care of at home by his wife. But he developed, I think, a respiratory infection, went to the emergency room, was in the emergency room in Quebec hospital for about 3 or 4 days. And his wife was pleading with them to get him a pressure mattress so he could turn. If you're quadriplegic, you can't turn. Didn't get a pressure mattress, didn't get turned by the nurses, instead developed bed sores that went to his bone. He was told to treat this will take months. And he didn't want to endure that. And he chose MAID. This was not an autonomous choice for a dignified death. What he wanted was a pressure mattress. What he wanted was a nurse to turn him. Instead, our healthcare system facilitated his death. And I have had some proponents of MAID say, oh, what was wrong with that? He had, once he got the bed sore, then what's wrong with that? At least he had the option for MAID. And I'm thinking, wow, our health system can't provide a pressure mattress, and we take that quick fix. So I think people want relief of suffering often.